So positives are quite uncommon with the RT-PCR testing. Um, where they happen is in a situation where there's cross-contamination of specimens, meaning that a specimen that contains COVID-19, some of that virus could be aerosolized and contaminate a second specimen which does not have COVID-19. And so that second specimen would then be falsely positive on the RT-PCR test. But laboratories work very hard to minimize the risk of cross-contamination, so it's not common. There could also be a specimen mix-up. That's another reason for having a false positive. But again, laboratories have many safety procedures in place to protect against that happening. False negative tests, again, the rate of false negative tests varies with the type of test. And a false negative test can happen if one has a very low viral load, which can happen in the first couple of days after infection, or can happen at the end of the course of the infection. And so in both of those situations, you can get a negative test result even though you've been infected with COVID-19. And then some of the tests are also less sensitive. Like, for example, some of the point of care tests for the RT-PCR are less sensitive, and so they have more false negatives. And the antigen test has more false negatives. So it just depends on the test performance characteristics of those types of tests. So the person may be infected, but the sample may turn out to be negative on PCR. And so that can be one source of differences between two tests, especially if they're being done in the same time frame, both on the same day. Maybe one was performed on a good sample and the other one was performed on a sample that was non-representative. It didn't contain the infectious material. Another reason for discrepant samples is if they're days apart, is that you may be sampling someone at different points in the evolution of their infection. So your ability to detect infection on PCR depends upon having viral RNA that you can assay for on the PCR instrument. And early on in the infection, you may have very little viral RNA, and so it may be below the limit of detection of the instrument. And then that viral load will go up as the infection progresses, and then it'll come down again as one develops immunity to the infection. And so if you are sampled at different points in that timeline, you may end up with a positive at one point, a negative at another, or vice versa. So, where you are in the course of the disease is also important in explaining discrepant results. False positive is not common with the PCR testing or with the antigen testing, but it's quite common with antibody testing. And that's been one of the limitations. If you live in a low prevalence area like we do, a lot of the positive antibody test results are false positive results. And people may have had another type of coronavirus, or they may have some other cross-reacting antibody that is reacted to as positive by the test.